Hi, my name is Dr. David Wade, and I wanted to talk to you briefly about spinal decompression and the importance that is able to provide for you for serious disc problems, sciatic problem, and degenerative disc problems that may have not responded to other types of care and treatment. If you're interested in trying to take care of your spine in a non-surgical manner without having to have needles stuck in your spine or have your back cut on with plates and screws, then what you need to do is consider the spinal decompression program. Now, I need to explain to you a little bit about spinal decompression so you understand the importance of how it works. I will tell you that we've been using spinal decompression very successfully in our office since the early 90s. We were one of the early innovators in the county bringing spinal decompression to this area, and we've been using it now going a little on over 20 years. We have about an 86 to 92% success rate depending on the type of problem that you have, which can be discussed with you at your consultation. One of the things that happens with the disc is that it is a normal structure that is designed to support the vertebra and protect the bones from rubbing against each other, and yet at the same time create part of the space for the nerve to be able to exit from the spinal cord out through the vertebra and down into wherever that nerve happens to go. In a disc bulge or herniation, what happens is the annular fibers, the rings that surround the jelly part of the disc, can stretch and open up and allow the disc to not hold the jelly nucleus in its normal position. And as a result of that, it allows the jelly to slip through and to bulge out and to compress or irritate the spinal nerve roots or the actual spinal cord. This is a very serious problem, and up until spinal decompression was introduced into our country, the only real solution for that was what they call decompression surgery. Decompression surgery is some type of surgery that's designed to go in and suck out that disc and ultimately remove the space that the disc was previously occupied, but they remove the bulging, offending part and effectively take pressure off the nerve. But unfortunately, that accelerates the degenerative changes, and it's really not the best or most optimal way for the disc to heal. It does, in some cases, help. However, you're left with a scar, and unfortunately it's not a good success ratio for the number of surgeries that are done. Currently, the statistics are staggeringly poor for disc decompression surgery. Some places anywhere between 32 up to maybe 60% success rate. Compare that with the 86 to 92% success rate that we have with the non-surgical effect, and you don't have to go through anesthesia, you don't have to be cut on. I think it's a viable alternative. The original decompression tables were invented by some medical doctors who actually had a disc problem very much like you might have, and they, based on their understanding of anatomy, decided that there had to be some other way to help decompress the disc other than through surgery. So what they have done is they've created a specialized concept of tractioning where they strap and hold the lower part of the spine in position for a lumbar disc, and then they wrap and strap the upper part of the torso on the table, and you can either lay supine or prone. That's dependent upon the type of mechanical problem that you may have. But what happens is this table slowly opens up and decompresses the space, opening up the joint, creates a vacuum within the nucleus area. The vacuum actually sucks the jelly back into its neutral position, effectively reducing the stress off the nerve and the disc. Now, this is not a one-time thing, but it's designed to be utilized anywhere up to 20 sessions. The original protocol was daily sessions for 20 visits, but we have incorporated some additional strategies utilizing electrical therapy and some passive motion and the adjustments, which allows us to not have to see you every single day, but it still takes a period of time. The number of visits is still approximately the same, but we feel like we're making a stronger, more effective long-term recovery utilizing our protocol. And this protocol we've developed over the last 20 plus years by doing this successfully with many people. We've had literally thousands of patients that have utilized spinal disc decompression over the last 20 something years. And I'm excited to tell you that there are times, well, I will take, since we're not 100%, there have been times where we have had to, subsequent to the decompression, still refer people on to have surgery. But I can tell you with really great confidence that we have never had to have anybody that we've referred to have surgery that had to have a second surgery, except for it was one particular instance where this lady was down in Mardi Gras, and she it was late New Year's, and she got thrown down on her rear end, and she ended up re-traumatizing her spine. That's the only one in 20 years that I know of that the surgery actually failed. So everybody else, the surgery has been successful, and we've been able to basically resolve problems that were previously, that people thought they were going to have to learn to live with, or they were destined to the unfortunate consequence of having to have surgery. So we're real excited about spinal decompression. The decompression does a number of things besides just creating the vacuum within the nucleus space, which is very important, by the way. It actually tightens up the annulus behind the disc as it's drawn back, the nucleus back into the neutral spot. By moving it and opening it up repetitively, it's drawing nutrients back into the disc, and so even a previously deteriorated disc that has advanced degenerative changes can now ultimately be changed long term by incorporating a strategy of nutrition being reintroduced back into this. Very healthy, very beneficial. The long-term effect of this is that you have a healed disc that has now become stable and basically resolved. So it's one of those things that I think is probably one of the greatest tools that we've been able to utilize in the last, I've been practicing a little over 30 years now, and so this is without a doubt one of the greatest tools that we've been able to incorporate into our strategy of our multimodality treatment for spinal disc problems. So my encouragement to you is, if you're looking for a non-surgical option, is to choose the spinal decompression as a choice that would give you the opportunity to get your disc healed back up. Now, this is available for both cervical and lumbar disc, so both problems are very effectively handled utilizing the spinal disc decompression therapy. This is Dr. David Wade. I'm wishing you a good life and a healthy life, and look forward to meeting you.